Welcome to this explainer. Today, we're doing something a little bit different. We are taking a deep dive into an actual clinical manual, specifically the Department of Veterans Affairs' Therapist's Guide to Brief Cognitive Behavioral Therapy. Have you ever wondered how therapists manage to create massive change in just a few short weeks? Or what exactly is happening behind the closed doors of a therapy session? Well, today, we're peeling back the curtain. We're going to break down this highly structured blueprint and demystify the exact mechanics of brief CBT.
So here's our roadmap for today. We're going to start with the basics of brief CBT, look at the short-term timeline, identify suitable problems, evaluate patient fit, and finally, take a look behind the therapist's chair.
All right, part one, the basics of brief CBT. To really get this, we have to grasp the core premise of cognitive behavioral therapy itself. The big idea here is that it is incredibly hard to change your emotions directly. Like, you can't just force yourself to stop being sad or anxious, right? The mechanism looks more like this. A situation happens, which triggers a thought, and that thought ultimately drives your feeling. Now, you can't always avoid a stressful situation, but if you actively intervene in that thought bubble, you can actually shift those distressing feelings. It's a hugely empowering mechanism because it shows us that our emotional reactions aren't completely out of our control.
And because of that, a crucial thing to understand is that brief CBT is absolutely not just about venting on a couch. The contrast with traditional talk therapy is actually pretty stark. Where traditional therapies might lean into open-ended discussions, just talking through your week and getting general advice, brief CBT is a highly collaborative, hyper-focused process. You are literally acquiring skills and doing structured homework. It essentially condenses what could take years in a traditional setting into a super concentrated 4 to 8 sessions. You're using that time to build specific tools, not just to vent.
Which brings us to part 2, the short-term timeline.
So how exactly do therapists compress a typical 12 to 20 session protocol into such an efficient 4 to 8 session window? Well, the timeline has to progress logically and incredibly fast. Step 1 is orientation and setting very specific initial goals. Literally, there is no time to waste here. Step 2 jumps straight into active interventions. We're talking behavioral activation, structured problem solving, and relaxation training. And then, bam, before you know it, Step 3 is already focusing on ending the treatment and helping you maintain those changes totally on your own.
You really see the dramatic contrast when you look at the beginning versus the end of this timeline. Session 1 is all about assessing your initial concerns and mapping out that treatment plan. But fast forward to Session 8, it is entirely dedicated to ending treatment and keeping those hard-won changes going. It's a rapid, decisive shift from identifying the problem to immediately equipping you to handle it moving forward.
Let's jump to part 3, identifying suitable problems.
Now, as amazingly efficient as this time-limited timeline is, we have to be real here. It is not a magic bullet for every psychological issue. Brief CBT is absolutely fantastic for acute adjustment issues or medical conditions, especially in a primary care setting. We're talking generalized anxiety, mild to moderate depression, struggling with diet and exercise, or coping with a brand new medical diagnosis like COPD or starting chemotherapy. It excels at those specific targeted symptoms. But it really struggles with pervasive, long-standing interpersonal conditions like paranoid personality disorder or active alcohol dependence. Those kinds of conditions naturally require a higher level of care, more comprehensive treatment, and just a much longer time frame than a few weeks can offer.
Moving right along to part 4, evaluating patient fit.
Even if a patient has the perfect clinical diagnosis for brief CBT, a therapist still has to look way beyond the label to assess if they're actually ready for this fast-paced program. Just reflect on your own readiness for behavioral change for a second. First off, you need strong motivation to change, and actually, higher distress often brings higher motivation. Second, time commitment. Are you actually going to do the out-of-session homework? Third, and this is a huge one, manageable life stressors. If you're constantly putting out daily fires, every session turns into crisis management, making it basically impossible to dedicate your energy to focused weekly homework. Fourth is cognitive independence. You need to be able to read materials and work independently. And finally, the severity of comorbidities. Having a bunch of complex, overlapping issues can definitely impede the fast progress required here. So yeah, it is a pretty rigorous checklist.
And finally, part 5, behind the therapist's chair.
Okay, let's shift focus to the human element required to deliver this treatment, because we really have to talk about something called non-specific factors. Now, CBT is super technical. It is heavily structured with its worksheets and tight timelines. But get this, it's actually these non-technical, relationship-based factors that are responsible for a massive percentage of the positive change someone experiences.
The manual explicitly emphasizes that without rapport, trust, and a true sense of safe collaboration, all the cognitive worksheets in the world just aren't going to help. These relationship factors are the absolute foundation that makes a patient open to exploration and change in the first place. And to cultivate those essential skills, therapists are constantly honing their craft behind the scenes. They specifically distinguish between supervision and consultation. Clinical supervision is the formal stuff. It involves direct oversight of clinical cases to evaluate the clinician and ensure patient safety. Consultation, on the other hand, is more like a growth-oriented chat with peers. There's no formal oversight, it's purely for professional development. It just goes to show that learning to deliver brief CBT isn't just reading a manual once. It's a continuous, dynamic process of feedback and growth.
I really want to wrap up our clinical discussion with this powerful quote right from the manual. Empathy is the ability to understand experiences from another person's point of view. It is a solid first step towards understanding patients' unique life background. I love that. It's such a beautiful reminder that validating someone's experience through active, multicultural listening is still the beating heart of the whole process, even within the most rigorously structured, time-limited therapeutic manuals. Genuine human empathy is the absolute non-negotiable starting point.
And that brings us to the end of our explainer on brief CBT. Before we wrap up, I want to leave you with one final thought, a way to apply what we've unpacked today to your own life. If you only had 4 therapy sessions to radically change a core distressing belief about yourself, what specific thoughts or behaviors would you bring to the table? How would you prepare to do that heavy lifting? Thanks so much for joining me to decode this fascinating blueprint today. Keep learning, keep questioning, and I'll catch you next time.